So I had this fun idea to reach out to people who work in the medical field and ask them some random questions. These questions aren't really hard, but as the weeks go by, I'm gonna step it up and ask some really unexpected questions. So this is just a start. I was so excited doing this because I really like hearing people's answers and their experiences, and so I'm going to share that with you today, and I hope you enjoy. So the first person, I'm going to let her give her own introduction.
Hey guys, my name is Olivia. I am a registered nurse who studied in Jamaica but is currently practicing in the United States. I was asked to answer a few questions. The first question is the part of your job that you are best at. I think as a nurse you have to interact with your patients a lot. A little more than doctors do. I think the part of my job that I'm best at is building rapport with my patients. It helps me to care for my patients holistically. So, when I enter my patient's room, I enter like a friend. So I'm like, hey, how you doing? Like straight off the bat, I'm building rapport so that my patients trust me. Especially when you're working with older patients, you have to build that rapport. Because when you look like a young nurse walking in their room, they tend not to trust you, or they're very hesitant with what you say, what you're doing. So I think I am best at doing that, building rapport to enable me to holistically care for my patients, mind, body, everything. I'm the type of nurse who will pray with my patients, who will sing with my patients. That's the kind of nurse that I am. The second question was your least favorite thing about, well, in my case, nursing school. Everything. I did not like nursing school at all. I'm currently at a place where I'm applying to go to school to get an advanced degree, and I am so hesitant because I do not like school. I don't like studying. I don't like waking up early. I don't like any of that. So for me, all of nursing school, I didn't like it at all. That's my honest answer. The weirdest thing about my job, flirting old men. That's the weirdest thing. As a nurse, you get that a lot. You get that a lot because you're around your patients for 12 hours. And especially these old men, they think it's cool and nice to flirt with you and tell you all the things that they want to do to you and with you. Sir, no, I am here to take care of you. But yeah, I think that's the weirdest part about my job. It makes me uncomfortable and I don't like it at all.
Good morning, my name is Maluki Carter. I'm an OT attendant, operating theater attendant. I work at the Mandeville Regional Hospital.
Alright, the first question is, what's the weirdest thing about your job?
Well, the weirdest thing about my job is to see certain cases, like some type of cases in the department, like certain doctor doing certain procedures, and like I'm wondering if the patient is gonna make it or not.
Alright.
But eventually they do, because the doctors here, they're good. I give them a thumbs up for that.
Alright. Good morning, miss.
Good morning.
Okay, so I'll be asking you some random questions. Is that okay?
Yes, no problem.
What's the weirdest thing about your job?
The weirdest thing? Oh, the weirdest thing is getting here early and starting late.
Oh,
Yes.
that happens a lot. Yeah.
Most of the times, that is what we face with.
Oh.
Mhm.
Hi, my name is Ophelia Belanfante, a general practitioner who has been studying in Jamaica for the last 2 years. This is the weirdest part or the hardest part of my job, when you have a patient and you know what is coming and there is nothing you can do. With the resources, whatever else, there's nothing you can do. I also hate when a patient passes and you just have to carry on, because reality is there are other patients who are living that you need to take care of. So you just have to pack up your emotions, do what you have to do, and carry on. I also hate breaking bad news, which kind of ties in with that, because you never know how the family members will react, and In grieving, sometimes the reaction isn't what you expected, but it's something that you have to face, and it is something that you have to do. It's a part of your job. So I'd say for now, that is my least favorite part. Being that I am from Jamaica, but I studied in China, there were moments when I wanted to come home, whether it was because somebody died, because I was feeling homesick, or I just wanted to be around my family. And I couldn't. So I came back for the summer breaks, but during the year, there were moments when I just felt like I needed to be home. Also, at times I felt like I was at a disadvantage because in China you don't get to do the practical aspect of your studies until your final year, which is your 6th year. Whereas if we did study in Jamaica, then we would have been exposed to that aspect from earlier on. So you would have been doing practical while you're still doing the theory, and I felt like I was at a disadvantage for that. We later found a way around that to clear that up and to make it better for us.
I'm Miss Louise. I'm a OT attendant.
I'm Nikisha Williams. I'm an operating theatre attendant.
Okay, so could you tell me everything about your job? Like, what do you do?
Well, my job entailed me to wash instrument. The instrument that was used in the case, my duty is to wash them and let them dry so that they can wrap and sterilize. That's my job. And sluice blood on the clothes, on the jar sheet and split sheet that are used in the case. That's my job.
Alright, thank you. So, what's the weirdest thing about your job?
Working with this girl.
I don't think that's the weirdest thing.
You can't tell me what is my weird.
I think the weirdest thing is for me to be here with her on the same shift. Apart from that though, the weirdest thing I would say is just seeing the blood and everything and the smell and everything else.
The weirdest thing for me is the different cases where you can sometimes get a glimpse of it's really scary. Sometimes it make you don't want to eat pork or beef. No, seriously.
For real? Like, how you get through all of that?
How do you get through all of that?
You have to come with a mindset, a real mindset for the job. Because trust me, it can wear you down.
Alright, so thank you.
You're welcome.
The last question was there ever a time you felt like you didn't know what you were doing? Yes, yes, and yes. I started practicing in Jamaica, and I vividly remember my first day. I felt so lost because to me, school and actual nursing practice is almost night and day, to be honest. I felt so lost. I could give a story, but I don't want to embarrass myself, so I closed that. But yes, my first day working as a nurse in Jamaica, I did feel like I didn't know what I was doing. And also when I started working in the US, because things are so different here, equipment, medications, like charting systems, it is so different from back home. So there have been times when I felt like I don't know what I'm doing. But in the medical field, you have to quickly change that and know what you're doing and do it good. So I think those were quick and easy questions and quick and easy answers. Thank you for reaching out.